When I first went into pain medicine, I actually wanted to be an orthopedic surgeon. And I didn't match, and I ended up doing a year of general surgery, went into anesthesia, and I really, at that time at Texas Tech, I had never met Dr. Rotz, and I had never met Prithvi Raj. It wasn't until my second year in clinical anesthesia that I saw Dr. Rotz and was doing the anesthesia for a lot of his cases, and that's how my interest in pain medicine started. And I never really thought about trying to become an expert in anything. I mean, there are so many things with pain medicine that we could attack, but one of the areas that seems to be an area that a lot of physicians do not want to treat, whether it's because they don't have the expertise or the knowledge, is the head and neck. And so Dr. Rax and Dr. Raj kind of pushed me into treating facial pain, because a lot of doctors will treat neck, low back, but when it comes to face pain, they don't want to do it.